There is a moment, silent and unannounced, that takes place deep within the body sometime after the age of 60. It is not a dramatic event, and most people never consciously register that it has occurred. The same pill you have swallowed without a second thought for years, the one your system tolerated and processed without any apparent difficulty, can suddenly start to act in a completely different way. The medication itself hasn't changed. Its chemical structure is identical. The transformation is all on your side. Your body has been altered by time, and this change in physiology fundamentally affects how it interacts with the very substances you are putting into it. In certain cases, this difference is not a minor adjustment. It can be the deciding factor between the drug offering protection and it introducing significant risk. It can be the difference between maintaining stability and a silent, dangerous buildup towards a critical event, such as a heart attack or a debilitating stroke. What makes this situation particularly treacherous is the complete absence of early warning signs. There is no sudden pain, no alarming symptom, no obvious red flag. It is a quiet, stealthy shift that occurs beneath the surface of your everyday awareness. There is no clear signal that anything has changed in the relationship between your body and your medication. And today, we are going to take a deep dive into 5 distinct categories of medications that, after the age of 60, have been linked in clinical research to an elevated risk of serious cardiovascular incidents, especially when there are other underlying health conditions present, or when they are taken in the exact same manner as they were a decade or more earlier. But this is the most crucial aspect of the entire discussion. This conversation is not intended to provoke fear or anxiety. The goal is not to make you paranoid about your prescriptions. The purpose is to give you a clear, evidence-based understanding of the actual physiological processes occurring within your body. With this knowledge, you are then empowered to make better, more informed decisions about your health moving forward, working collaboratively with your healthcare providers. My name is Dr. Alan Mandell. I am a medical doctor and physician, and on this channel my mission is to translate complex and often confusing health information into clear, straightforward, and practical explanations. The aim is to help you truly understand the inner workings of your body and to identify the strategies that actually make a lasting positive difference in your long-term health and well-being. If you find this kind of detailed, no-nonsense health information beneficial, you are welcome to subscribe to the channel. However, more importantly than that, please stay with me through this entire presentation because one of the drugs we are about to discuss is one that is consumed daily by tens of millions of individuals, and it is a medication that is almost never scrutinized or questioned. Now, in order to grasp why these risks begin to increase significantly after the age of 60, we must first establish a fundamental principle that is rarely explained to patients. The simple truth is that your body no longer processes medications in the same way it once did. This is the pivotal point where everything begins to change. As we advance in years, several interconnected systems within the body begin a gradual but inevitable deceleration. The liver, which serves as the primary processing plant for breaking down and metabolizing a vast array of medications, becomes less efficient in its enzymatic activity. Simultaneously, the kidneys, which act as the body's filtration system, removing waste products and excess substances from the bloodstream, also experience a decline in their filtering capacity. The consequence of these two processes is that drugs remain in your system for a longer duration. In many cases, they remain active for much longer than what would be considered standard for a younger person. This means that a standard, normal dose can begin to exert the same effect as a higher dose simply because the drug is not being cleared from your system at the expected rate. However, that is merely one piece of the puzzle. There is another, equally significant shift happening in how your blood vessels respond to various stimuli. Your arteries, which were once elastic and pliable, become more rigid and less flexible over time. The delicate inner lining of your blood vessels, known as the endothelium, becomes more sensitive and more vulnerable to damage. The patterns of your circulation are altered, and the intricate balance that exists between clot formation and bleeding becomes more precarious. Consequently, when a medication interacts with any one of these systems, the resultant effect can be significantly amplified. This is the point where many people are led astray. The medication itself is not inherently dangerous. It may have been completely appropriate and beneficial when it was first prescribed. It might still have therapeutic value today. The problem is that the context in which it is being taken has fundamentally changed, and medicine, more than most people realize, is almost entirely dependent on this very concept of context. The same drug can be a life-saving therapy in one situation and a dangerous risk factor in another. The identical dosage can be perfectly safe and effective at age 50 and become excessive and harmful at age 70. Yet, in the reality of daily medical practice, prescriptions are often renewed and continued for years on end without a thorough, detailed reevaluation. This is not because doctors are negligent or don't care about their patients. It is largely because these physiological changes occur gradually and silently, operating in the background without any overt signs. This slow creep makes them easy to overlook in a busy clinical setting. Now, let's consider the broader picture. After the age of 60, the inherent baseline risk of experiencing cardiovascular events, such as heart attacks and strokes, naturally increases. This is a well-established biological fact. The danger arises when specific medications are introduced on top of this elevated baseline risk, particularly if those medications are not adjusted or modified over time. They can push that risk even higher. The effect can be subtle, a slight nudge upward, or it can be significant. Often, this elevation occurs without any obvious symptoms manifesting themselves until a major event occurs. This is precisely why today's topic is so critically important. We are not simply having a conversation about pharmaceutical compounds. We are discussing the dynamic interaction between these compounds and your body as it exists at this specific stage of your life. And, crucially, we are going to talk about what you can do about it. Now, before we move on to the first two medications on our list, there is one essential idea you must keep firmly in mind. Nothing we discuss today should be interpreted as a recommendation for you to stop taking any medication on your own authority. That is absolutely not the goal of this presentation. The objective is to foster awareness. When you understand the underlying mechanisms of how these medications work and how they interact with an aging body, you can ask better, more pointed questions. You can engage in more productive and informed conversations with your doctor and pharmacist. And you can avoid the trap of remaining on a medical autopilot with a treatment that may very well need adjustment. This is where the first layer of risk begins to materialize. The first two drugs we are going to examine are among the most frequently used in the general population, especially among those over 60. They are often taken every day, are widely perceived as being completely safe, and yet, under certain conditions, they can quietly increase the workload on the heart, push blood pressure in an unfavorable direction, or alter the dynamics of blood flow through vessels that are already sensitive and compromised. Once you see the physiological process behind this, you will understand that this is not really about the pill itself. It is about timing, it is about the specific dosage, and most critically, it is about how your own body has changed over the decades. Let's begin with a class of medication that is incredibly common. It's a drug that many people pop without a moment's thought, often for years and sometimes for decades. And yet, after age 60, its behavior inside the body undergoes a profound transformation. The first category is a group of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. This familiar list includes medications like ibuprofen, naproxen, and even some stronger prescription-strength anti-inflammatory agents. They are a go-to solution for joint pain, back pain, the stiffness of arthritis, and everyday aches and inflammation. For countless individuals, they feel like a simple, effective, and harmless solution. You take one, the pain fades, and you are able to get on with your daily activities. But beneath this surface-level relief, a different process is unfolding. NSAIDs function by blocking specific enzymes that are key players in the inflammatory response, which is what reduces the sensation of pain. However, these same enzymes also have a crucial role in protecting the health of your blood vessels and in maintaining optimal blood flow. This is where the problem begins. After 60, your blood vessels are already losing their youthful flexibility and are more susceptible to stress. When NSAIDs interfere with this protective system, they can inadvertently cause a subtle constriction or tightening of the blood vessels. This tightening, in turn, elevates blood pressure. This rise is not always something you can immediately detect. It can be gradual, quiet, and persistent, operating without you even noticing. At the same time, NSAIDs can influence how your kidneys regulate the body's fluid balance. They can cause the body to hold on to more sodium and water, which adds an additional burden of fluid volume to the cardiovascular system. So you have two distinct but concurrent issues, an increase in blood pressure and an increase in fluid load. For someone whose cardiovascular system is already working harder and is less resilient after the age of 60, this combination is a serious matter. A wealth of large-scale studies has consistently demonstrated that prolonged or frequent use of NSAIDs is correlated with an elevated risk of heart attacks and strokes, particularly in older adults or in individuals who already possess existing cardiovascular risk factors. This is another example of where people are easily misled. The relief they feel from the medication is immediate and tangible, while the damaging impact builds up slowly, invisibly, over months and years. You don't sense your blood pressure rising in real time. You don't feel the added strain being placed on your arteries day after day. But the cumulative effect over a long period is undeniable. Now, this is a key distinction to make. This does not mean that NSAIDs are inherently bad drugs. It simply means they must be employed with a heightened sense of awareness. Short-term use, occasional use for a specific acute injury, or carefully monitored use under a doctor's guidance may all be perfectly appropriate. However, daily, long-term consumption without a periodic reassessment after hitting 60 is where the risk begins to escalate significantly. This brings us to our second medication. This one is even more subtle in its effects and, consequently, even more underestimated by both patients and, sometimes, practitioners. This is a class of drugs known as proton pump inhibitors, often abbreviated as PPIs. This group includes widely prescribed medications like omeprazole, esomeprazole, and other similar acid-reducing drugs. They are a common prescription for acid reflux, chronic heartburn, and for providing stomach protection, especially in people who are taking other medications that might be irritating to the gastric lining. On the surface, they appear to be incredibly benign and harmless. They work effectively to reduce stomach acid, they alleviate discomfort, and they can protect the stomach lining from damage. But this is where the story becomes less obvious and more nuanced. Stomach acid is not simply there to cause problems or create uncomfortable sensations. It serves an essential role in the digestive process, particularly in the absorption of key nutrients. This is especially true for minerals like magnesium and calcium, and for vitamins such as vitamin B12. Over a long period, the continuous use of PPIs can significantly reduce the absorption of these vital nutrients. At first glance, this might not sound like it has a direct connection to a heart attack or a stroke, but it absolutely does. Magnesium, for instance, is a critical electrolyte that plays a pivotal role in maintaining a stable and regular heart rhythm. Low levels of magnesium can increase the risk of dangerous, irregular heart rhythms. Calcium balance is fundamental to proper vascular function, and vitamin B12 is essential for maintaining the health of blood vessels and nerve function. When these nutrient levels are compromised over time, the entire cardiovascular system becomes more fragile and vulnerable. But there is another, even more direct layer of effect. Some research studies have suggested that the long-term use of PP may have a detrimental effect on the function of the endothelium, which is that delicate inner lining of the blood vessels. This lining is absolutely critical for controlling blood flow, managing the clotting cascade, and allowing blood vessels to relax and dilate properly. When the endothelium is not functioning at its peak, the risk of vascular events, such as clots and blockages, increases. Again, these effects do not appear overnight. They build up slowly and quietly, often entirely without any clear or recognizable symptoms. Now, this is where many people make a critical mistake. A patient is often started on a PPI for a short-term issue, such as a bout of acid reflux or stomach irritation caused by another medication. However, they then continue taking it for years without any reassessment of the need for it. This is because it feels safe, because it was originally prescribed by a doctor, and because nothing overtly seems to be going wrong. But the longer the medication is continued without a formal review, the more these underlying effects accumulate and begin to matter. This is where awareness can make all the difference. The solution is not always to stop the medication entirely. It might be to shorten the duration of use, to reassess the clinical need for it, or to explore whether a lower dose or an entirely different, safer therapeutic approach is now more appropriate. But that kind of evaluation only happens when the right questions are being asked. What we have covered thus far is merely the first layer of risk. Two very common drugs, two distinct mechanisms that quietly place an increasing strain on the cardiovascular system. But what comes next is where this discussion goes into deeper waters. The next two medications we will talk about do not just affect blood pressure or nutrient levels. They interact much more directly with the fundamental function of your heart, the movement of your blood, and your body's overall response under physical and emotional stress. Once you grasp this part of the picture, the whole landscape becomes much clearer. Now we transition from the subtle to the significantly more impactful. The next two medications don't just have an indirect influence on blood pressure or nutrient absorption, they have a direct and potent effect on how your cardiovascular system behaves when it is under stress. In many instances, the consequences are not immediate or acute. They develop slowly over a period of months or even years, which is precisely the reason why they are so frequently missed in routine medical checks. Let's address the third one. This is a class of drugs that are routinely used to manage sleep disorders, anxiety, or to generally calm an overactive nervous system. These are known as benzodiazepines. Common examples include diazepam, lorazepam, and several similar agents. They are very effective medications. They can quickly reduce feelings of anxiety, they can be helpful for sleep, and for many people, especially as they get older and face new stressors, these drugs can feel like a necessary support mechanism. But what is happening under the surface is what matters most. Benzodiazepines work by acting on the central nervous system. They slow down brain activity, which is precisely what creates that calming, sedative effect. However, they do not only slow down brain activity, they also slow down other critical systems throughout the body, including breathing rate, reaction time, and physical coordination. You might be wondering, how does that connect to the risk of a heart attack or stroke? This is where the detailed mechanism becomes incredibly important. As we age, the body's sensitivity to these types of medications increases. The drugs stay in the system for longer periods. They build up in the tissues more easily, and their sedative effect becomes more pronounced, even at the exact same dosage that was previously tolerated. Over time, this can lead to a measurable reduction in physical activity. People move less, they are more sedentary, and they spend more time sitting or lying down. This is more significant than most people realize. Circulation is heavily dependent on movement. When movement decreases, blood flow becomes less efficient. Blood pools, the risk of clot formation rises, and the delivery of oxygen to vital tissues becomes less optimal. But there is another, even more concerning layer. Benzodiazepines can have a negative impact on breathing patterns during sleep. They can contribute to shallower, less effective breathing, and they can worsen pre-existing sleep-related breathing disorders like sleep apnea. When oxygen levels drop repeatedly throughout the night, even slightly, it places a significant and cumulative strain on the heart muscle. So what you have is a dangerous combination: reduced overall circulation, lower oxygen levels in the blood, and an increased vulnerability in a cardiovascular system that is already challenged by the aging process. Again, this doesn't manifest as a dramatic event. It feels like fatigue. It feels like slower, more difficult mornings. It feels like what many people dismiss as simply normal aging. But underneath that surface, the system is working much harder than it should be. This is where the long-term effect matters. Over time, these incremental changes can contribute to a notably higher risk of cardiovascular events, especially when they are combined with other risk factors like pre-existing high blood pressure or existing vascular disease. Now, here is something that most people never realize. The risk is not just from the simple act of taking the medication. The danger comes from taking it continuously at the same dose for the same indications without any reassessment as the body's physiology fundamentally changes. This thought leads us directly to the fourth medication on our list. This is where the situation becomes even more complicated, not so much because of what the drug does on its own, but because of how it interacts with everything else a person might be taking.